Sean, I want to ask you about the town halls and what
Yeah.
we're hearing about Obamacare. The president referred to so-called angry crowds at these town halls. Is he suggesting this is manufactured anger, that this is not real anger and real concern?
Yeah, thanks. I think there's a hybrid there. I think some people are clearly upset, but there is a bit of professional protester manufactured base in there. But there are people that are upset. But I also think that when you look at some of these districts and some of these things, it is not a representation of a member's district or an incident. It is a loud group, small group of people disrupting something in many cases for media attention. No offense. It's just, I think that necessarily, just because they're loud doesn't necessarily mean that there are many. And I think in a lot of cases that's what you're seeing.
Does the president doubt that there's real anger and real
I just said
concern
that.
out there beyond just a few loud agitators, that there's real concern that people may lose their
But they won't.
healthcare
But see, I think that's a false narrative. And I don't. The president's been very clear. Look, you have to look at what our healthcare system is right now. In so many counties around our nation, we've gone down to one provider. That's not choice. That's not access. And then they're going in a lot of cases and they're saying we're not taking Medicaid, we're not taking TRICARE, we're not taking the insurance you used to have, the doctor that you used to have isn't participating anymore. And oh, by the way, states like Arizona, you've got over 100% increase in premiums. 112, I think, was the number there. In many states, it's double digit. And I think that the idea that we have to remember is that the American people got sold the Affordable Care Act. It's neither affordable or accessible. They're losing their coverage and premiums are spiking. And so if people are truly worried about losing their coverage, they should be applauding the president's action for wanting to make sure that we put a system in place that does what they were supposed to have been promised a while back. And I think that's what I think is missing from this dialogue. I've seen some folks that were protesting at some of these things, saying, I'm on Obamacare, I'm going to lose my thing. And when they were asked how old they were, I'm 71, 72. Well, they're not on Obamacare. They're on Medicaid.
So you think they're making it up?
No, I'm not they're making it up. But what I'm getting at is I think that there is a lot of blurring of the facts. And the reality is that some people aren't on Obamacare. They're on an employer-based system. They're on Medicaid. They're receiving their benefits through Medicare because of their age. And so that they're nothing, they have no problems. But I think in other cases, people are not being told that the plan that they're on is unsustainable, that these carriers throughout the country, you just look at them over and over again pulling out of the exchanges. The reality is that they are losing their health care. But they're losing it under Obamacare because the exchanges are collapsing on themselves, carriers are pulling out, premiums are going up, and access is going down. So the president's plan is actually going to do exactly what they were promised 8 years ago and didn't get. So for those who are worried, the answer is help is on the way.
What is the plan? We haven't seen.
Okay, so first, as the president made clear, we're going to have that out in the next couple of weeks. He's working on it. But the goal, Jonathan, is this got jammed through a Democratic Congress. And then they told us you could read it after we get it passed. So taking our time, getting this right to achieve the goals that we set forth is probably the right thing to do, considering the experience that we had the last time.